Well, thank you. And now turning to the next very exciting celebratory phase of this meeting, and maybe not as serious as the speech I gave you, would be our awards. The Gustav Lienhard Award for Advancement of Healthcare has been issued annually since 1986 by the NAM and the Robert Wood Johnson Foundation in recognition of outstanding achievement in improving personal healthcare services in the United States. I'd like to ask Glenn Steele, the chair of this year's selection committee, join me on stage to present this year's Lienhard Award.
Thanks very much, Victor. The Gustav Lienhard Award, established in 1986, is presented annually by the National Academy of Medicine in honor of Gustav Lienhard, chairman of the Robert Wood Johnson Foundation's Board of Trustees from 1971 to 1986. The award, a medal and $40,000, recognizes individuals for outstanding achievement in improving healthcare services in the United States. Support for the award is provided by the Robert Wood Johnson Foundation. This year's recipient is Stuart H. Altman, PhD, the Saul C. Chaikin Professor of National Health Policy in the Heller Graduate School of Social Policy at Brandeis University. Over the last 50 years, as an economist, Dr. Altman has helped improve the health insurance system in the United States and the efficiency of its delivery system. Dr. Altman has demonstrated leadership through service on federal and state government advisory boards, beginning with his role as Deputy Assistant Secretary for Planning and Evaluation for Health at the U.S. Department of Health, Education, and Welfare under the Nixon administration. His work in this role helped spur the growth of comprehensive management care and funded an important study measuring the impact of cost sharing on medical service use. Dr. Altman has acted as advisor to 5 U.S. presidential administrations in total. During his time at Brandeis University, Dr. Altman founded the Schneider Institute for Health Policy, a research center best known for developing the social HMO, which integrated financing for acute services, for long-term care, and for social supports to provide more effective coordinated care for elderly adults. To facilitate better research to support health policy decision-making, Dr. Altman and colleagues formed the Association for Health Services Research in 1981. Now, Academy Health, the organization, has more than 4,000 members and hosts a prominent U.S. Health Services Research Conference. Dr. Altman served as chairman of PROPAC, an independent commission to advise Congress on Medicare payment policy. Under his leadership, PROPAC became a widely respected source for unbiased, impactful analysis, and its recommendations frequently led to important policy changes. In addition to his leadership in national health policy, Dr. Altman's work as chairman of the Health Policy Commission in Massachusetts has led to reports and recommendations that are considered a model approach for states trying to control health spending without directly regulating. Dr. Altman has been a member of the National Academy of Medicine since 1979 and served on the Board of Healthcare Services within the Health and Medicine Division, and has been leading and involved in many high-impact consensus studies related to healthcare workforce, healthcare delivery, and healthcare infrastructure. Dr. Altman's work has made an important impact and continues to make an important impact on the healthcare of our nation. He is most deserving of this prestigious award. Stu, would you join us?
Good job. We're going to take a photograph, folks. Okay. How many hands do you have? This is all yours. All mine. Come on. Okay. Congratulations, Stuart. The podium's yours.
The podium is mine. Well, what an honor. Glenn, thank you so much. I know the committee had a lot of good options, and I'm really more than touched. As my family and I were walking in this building this morning, I couldn't help but think back to the early 1970s when I was asked, when I was then in the government, to work with a group of people to formulate what became known as the Institute of Medicine and now the National Academy. And it's hard to think back and think I would ever come and be in this position this time. I mean, the Institute of Medicine and the Academy have been such an important part of my life. I know I've known all the presidents, and I particularly want to thank Dr. Zhao and my good friend Sam Thier. Sam and I have been close for many, many years. I can't help but tell you that the two of us put together a health policy course at Brandeis, and I expect, Sam, that in the future some of our students will be standing up here in the future. So this has been a truly great honor for me. I want to give a little shout out, as they say, to my daughter, Dr. Heather Altman, and her husband, James Shortridge, who came here from Chapel Hill, along with their two children, my grandchildren, Sydney and Leah Shortridge. So this is a great honor. I did have the privilege of knowing Gus Lienhard and work with him and Dave Rogers, who was the president of the Robert Wood Johnson. If there ever was an odd couple in health policy, it was Gus and David, both physically and structurally on how they viewed the world. But you know what? They made the Robert Wood Johnson Foundation really work. I mean, if you think back over the years, what organization other than the National Academy has done more to improve health care and health policy in this country? So this combination of the Robert Wood Johnson Foundation and the National Academy giving me this award is really special. So thank you all, and I look forward to the rest of the meetings. Thank you very much.